Go ahead.
All right, so we're gonna discuss tongue thrust exercises. These exercises are really important because when a patient has spacing in between their teeth, whether it's an open bite when the upper and lower front teeth don't meet vertically, or if there are spaces in between the teeth horizontally within either the upper or lower arch, typically, more times than not, the cause of that spacing is a tongue thrust. And it doesn't matter if we close the spaces with braces or Invisalign. If we don't address the tongue thrust, the tongue will always recreate those spaces even after the treatment is complete, even if the patient is doing a good job wearing retainers. So, the first thing is to understand what's going wrong, and then we'll talk about how we fix that. Most patients who have a tongue thrust, their tongue will rest flat against the roof of their mouth. And oftentimes the tip of the tongue will push forward towards the front teeth. And so the tongue itself is a strong enough muscle that it can actually cause the spacing that we've just discussed. In every patient, there's always a battle between the lips and the tongue. When the lips win, if the lips are stronger muscularly than the tongue, then we will see crowding. The teeth will be overlapping one another. On the other hand, when the tongue wins, that's when we see spacing. So the first thing is you've got to be aware of where your tongue is when you're at rest, okay? So when you're watching television, reading a book, doing your homework, looking out the window, instead of allowing your tongue to rest flat against the roof of your mouth and the tip of the tongue touching the back of the upper front teeth, what I want you to do is take the tip of your tongue and touch it to the roof of your mouth, okay? Don't let the tip of your tongue come forward. I don't want you to feel your tongue touching the back of any of your upper front teeth. As long as the tip of your tongue can stay in the roof of your mouth, then that will prevent that pressure on the upper front teeth that causes the spacing. So throughout the day, periodically, 4 or 5 times a day, ask yourself, where's my tongue? If you feel the tip of your tongue touching the back of your upper and lower front teeth, take the tip of your tongue and move it back to the roof so that it touches the roof of your mouth. Number 2, when you swallow, most patients who have a tongue thrust will move their tongue in the same fashion. The tongue will press flat against the roof of the mouth, which will force the tongue forward towards the front teeth. If you have a tongue thrust, you can look in the mirror, keep your teeth together, and with your lips apart, swallow, and I bet you'll see your tongue come forward in between the spaces that are in between your teeth. So, what you should be doing, and what I want you to practice doing, is when you get ready to swallow, when you have something to eat or drink, take the tip of your tongue, push it to the roof of your mouth, and then don't let the tongue come forward when you swallow. Keep the tip of the tongue right there at the roof of your mouth, and then allow the tongue to move like a wave from the front to the back and push the food or liquid back to your esophagus. So this one's a little bit trickier because it's going to feel awkward, especially if you are, a teenager or an adult and you've never considered this before, you never knew you had a tongue thrust. It's definitely going to feel a little bit awkward. And it's a more difficult one to practice because when you get ready to have something to eat or drink, the first thing you're going to think is not going to be, oh, let me practice this new technique and physiological movement with my tongue. So don't let that frustrate you. Instead of trying to remember to do it each time you begin to have something to eat or drink, what I would like you to do is, after you have that first gulp, ask yourself, did my tongue touch the back of my teeth when I swallowed? And if the answer is yes, then I want you to deliberately practice the method that I just described on the next gulp that you take. And then continue to do that as the days go by when you are eating and drinking, so that way it becomes a habit. This is the best way to learn to address a tongue thrust. This is behavior modification. I always start with behavior modification because I've had patients who will use a habit-breaking appliance an orthodontic appliance that gets in the way of a patient's tongue pushing forward. We'll use an appliance like that, but if a patient has a bad habit and they don't take the steps to address that habit, then once the appliance has been removed, they can relapse. So the best way to address this is to understand, like I said in the beginning, where your tongue is now, what's wrong about the position of the tongue, and where it's supposed to be for patients who have a tongue thrust. So I've had really good success with this method. Many of my patients will catch on after a little while, and then you're off and running, and we don't have to worry much about relapse with spacing as long as you do a good job wearing your retainer. So hope this video helps, and good luck with your treatment.